Occupational English Test. Practice Test 1. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you will have 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a pharmacist talking to a patient called Matthew Jenkins. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
You must be Matthew Jenkins.
Yeah, that's me. Just here to pick up medication I called about.
That's right, for nausea, constipation and diarrhea.
Yeah, I've got this prescription. Is this drug a good one?
It depends. There are several medications that could alleviate your symptoms. You mentioned that this is not your first time you've had problems with your bowels. Do you remember what you took before?
Before I just took laxatives to deal with the constipation. And I think that's what this is now.
Yeah. Okay, and are you in any pain?
A little.
There's medication called mebiferine that may work. It'll certainly alleviate the constipation and ease any colicky pain too. It works on certain muscles in the walls of your intestine and causes them to relax. That's what eases the pain. I can give that to you today, and it's available as a tablet, modified release capsules, or oral liquid medicine. Which would you prefer?
Tablets, please.
Okay. Can I just check that you're not taking any other medications?
No, I'm not taking any others.
Have you ever had an allergic reaction to any medication?
I don't think so. No.
In that case, you should be fine. There aren't many side effects and it's pretty fast acting. They're 135 milligrams, and I recommend that you take 1 tablet 3 times a day. A lot of people take their doses around 20 minutes before their meals with a glass of water. They don't taste very nice, so don't try and chew on them.
Should I take them every day?
You'd usually take them when you need them, so don't worry if you forget a dose. And certainly don't take 2 doses together to make up for one you've forgotten. Just continue with the next dose when it's due.
Okay. I will certainly do my best to stick to them. I just hope that it works. It's getting really embarrassing. I work investments. Part of my role is taking clients to dinner, and we take them to some really nice places. Fancy china, more cutlery than plates, you know the type.
Okay.
I noticed that you're from America. Can you recommend any places to take my clients?
For food?
Yeah, for just drinks or food. Or...
Well, I'd avoid getting anything that's in a cart outside.
Okay.
I think we've all been there and had some issues.
Yeah.
I don't know. Have they been to New York before?
Some of them have. It's just really awkward. When I get through, going through a course, I have to dash off to the gents all the time. I don't know how many more excuses I can use to avoid taking clients out before I was getting started. So I'm thinking if I can just take them for drinks, maybe it's better than going for the whole dinner. Well,
there's plenty of rooftop bars on hotels, which are really lovely, and you can have drinks and have great skyline views. I recommend Soho and Chelsea, some great restaurants there.
Okay, I'll keep that in mind. Thanks for that.
No problem.
So other than taking these, Is there anything else that I can do to manage this condition? I guess I'm just worried that it's getting worse.
What did your GP say?
My GP thinks that I should change my diet. She says there's no cure, but that the symptom can be managed. But part of the reason that she sent me to you.
I'm inclined to agree with that. If you don't mind me asking, how old are you?
I'm 40 this month.
Now, naturally, IBS may get worse as you get older, but I suspect that this would be if you were to make no changes to your lifestyle at all. Are changes to your lifestyle something you can do?
Yeah, I can do that. I can do that. So thanks for your time. I'll take these to the counter now, and thanks for the other information.
Have a great day.
Thank you.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Nicole Von. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Von. How are you today?
I'm okay, dear. Are you here to see me because it's my birthday?
Of course, that's right. You're 62 today. Happy birthday, Mrs. Von.
Thank you, Pat. And please call me Nicole. My Matthew is coming to see me today too. He said he's brought me lots of presents and I'm very excited.
Oh, I bet you are. I won't keep you long then. I know you'll be wanting to get ready. I'll just make sure that you have your injection for pernicious anemia.
What's that?
It's just a fancy way of saying that right now your body's not producing red blood cells correctly. So this medicine will stimulate you to do that, okay?
Okay, dear.
It's the same injection that we did 2 days ago. Do you remember?
Yes, I do.
Okay. I'll just wash up in this sink and then I'll be with you, okay?
Sure, dear.
How are you feeling today?
I'm fine, dear. Just can't wait for everyone to arrive. Will you stay for the party, dear?
I'd love to. Only technically I'm still working, so I must dash after we finish. I can help you get ready, though.
Thank you.
Nicole, do you remember which arm you had the injection in last time?
My right arm.
Okay, we'll do it in the left arm this time. Before we go any further, I just need to check your identification if that's okay. Can you tell me what your full name is, please?
Nicole Eloise Von.
And your address?
18 Winstanley Street, London, W1H 5LL.
And your date of birth?
3rd of June 1956.
And do you have any allergies?
No, I don't.
All right, that matches the chart. You're the correct patient. The drug that I need to give you today is called hydroxycobalamin, and it's to be done every 2 days for 2 weeks through the IM route. Do you know what the IM route means?
I'm not sure.
It means intramuscularly.
Mm-hmm. Okay.
Are you still okay with having injections?
Will it hurt?
You'll feel a little pinch when the needle goes into your arm. And I must admit to you, there are some side effects, okay, Nicole? And some of these can be nausea or headaches. Now, think carefully for me. Did you have any side effects when we did it last time?
I don't think so. Nausea, you say? Yes, I did feel a little nauseous the last time. Will I feel nauseous again?
Not necessarily, it depends.
Okay, dear, then let's do this, Pat.
Thank you. I'll be as gentle as I can. First, I'll need to clean the area. Are you sitting comfortably?
Yes.
Okay. Is it okay if I lift the arm of your blouse?
Of course, dear.
Thank you. Oh, look at the clock. It's almost time for the guests to start arriving. Isn't that great?
Oh, yes.
I know Matthew is coming, but who else are you expecting?
The whole family, dear. He should be bringing Eloise, that's his wife, and the twins, Stephanie and Adam, so that will be a treat. You know, I've not seen the twins since they turned 3, and I hear they've grown so much. It's wonderful.
It really, really is. How old were they when you last saw them, sorry?
I think they were 2.5.
Ah, okay. Oh, and that's it. That's all done for you, Nicole.
Really, dear? Why, I didn't feel a thing.
I'm glad to hear that. And I'll pop a plaster on it in just a moment. I'll clean up now. If you need anything through the night or if you have any severe reactions, please call an ambulance, okay? It's dial 999. And if you do get nauseous again or have any rashes, will you call the district nurse's number for me?
Of course I will.
Do you still have it or would you like me to write it down?
I have it, dear.
Wonderful, wonderful. I'll get to cleaning up then.